Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Autumn Baidouri, Director of Healthcare Partnerships at Advocatia. Autumn has been impactful in her role of partnerships, using her interest in geography and urban planning to develop and support the individuals around her. She spent 15 years in Medicaid managed care and primarily in community engagement, developing health promotion programs that affect SUH. Her experiences in the field mean so much to her as she grew up on Medicaid, public housing, without the resources that are available nowadays. Because of that, her passion drives her to connect people to resources, especially low-income families, everyday people, and the elderly. In this conversation, she discusses her journey in public health, the importance of empathy, and the challenges faced in the healthcare system. She emphasizes the need for community engagement, the role of data in improving health outcomes, and the balance between traditional public health initiatives and emerging technology. Autumn also shares insights on accreditation and its impacts on healthcare community organizations, advocating for a more inclusive approach to healthcare access. Autumn also discusses the importance of diversity in technology and public health, emphasizing how varied backgrounds can lead to better solutions. She highlights the need for innovation in public health, particularly in the context of health equity, human geography, and transportation access. Baidouri also advocates for public-private partnerships and the role of listening to community voices in shaping effective health interventions. She also reflects on lessons learned from the COVID-19 pandemic and the significance of innovations in HIV prevention. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that have led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or just someone passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. Now let's have Autumn tell us a little bit about themselves. Welcome, Autumn, to the K in Clarity podcast. For the people listening, can you give a brief overview of who you are and what it is you do?
Sure. Thank you so much for having me. I really appreciate it.
Absolutely.
My name is Autumn Baidouri. I am currently the Director of Healthcare Partnerships for Advocatia. And what I do is I work with various different healthcare partners throughout the healthcare spectrum around with hospitals, health plans, community partners, et cetera, to ensure that people have access, intuitive access to public benefit applications and services through our technology, our platform, so that actually simplifies the application process for public benefits. So we work with people, their members, their patients, et cetera, to be able to apply them for public benefit programs, such as Medicaid and SNAP and Medicare, whatever the public benefit program is, as well as over 1,000 different social determinants of health programs that are available, whether they're federal, local, or at the state level. So it's really exciting to be able to make an impact on people's lives and making sure that they have the benefits that they're entitled to, as well as things that putting money back in their pockets, such as through SNAP and LIHEAP, et cetera, to ensure that they can have a healthy life.
I know we're going to talk about a lot about public health, but we like to do a little icebreaker before continuing a conversation. So my icebreaker for you is if you could build your own, superhero to really focus on public health and really revolutionize the type of care that people are going to receive, what would that superhero look like and what would they be doing?
That's an awesome question. I think, honestly, they wouldn't look like anything because they would be invisible.
Okay.
And they would be able to go through and see how people react, what their issues are, without having an oversight and letting them know that people are around so they can really get the true grit of what life is like for people who are experiencing issues. Because often people are wary of authority figures or people from agencies or, people who are from the health systems, et cetera, that are creating those public health innovations. They're more resistant to telling their story than most people would be, especially from people from the Black community who have suffered injustices for hundreds of years, particularly, as well as Latino communities that are facing tons of public health epidemics like diabetes and heart disease, et cetera. So I think that there's definitely a way to gather intel from various communities to be able to create those public health innovations. But we got to do it in a way that's not intrusive to others.
Okay. I know when we had spoken previously, you have a great passion for public health, and I love that. So can you tell us a little bit about how you got into this and what your focus is?
Yeah, absolutely. So I actually started my career in healthcare in about 2008. And I actually was the executive assistant to the senior vice president of public affairs and marketing at a managed care organization. And she was responsible for designing health program for various communities in the Medicaid population. So we would go to various low income neighborhoods and, bring community health programs to the neighborhood versus having people come over there. And being a child that was brought up on Medicaid and having various adversity in my life, I really took a passion to Medicaid and really thought that I could contribute something to the health programming design or the initiatives that through community health that really could impact people from my own personal experience, as well as just, I love to learn about people. I love to hear their stories. So it was really just a great fit for me to be able to serve the community in the way that I could through my education and my experience, my personal experience in being underserved.
I think with what you've spoken, what do you think is something that, healthcare leaders don't really understand about public health that you probably want to educate them on?
I think everyone has blind spots. And I think that whether it's from your background or your knowledge base, whether you're more of an academic person versus someone who didn't get their education till later on in life like myself, someone who grew up in the thick of it versus someone who maybe had a more affluent background. I think that there's just a lot of different barriers to helping people understand things. Been some really great initiatives through different organizations, community organizations, as well as some healthcare organizations that actually put people in positions, through a workshop that puts people in positions of different people who are on Medicaid, whether it's, dropping your child off and then getting to your low paying job and then what if your child gets sick? You have to leave that job to go pick up your child. But if you leave your job, you're going to get fired because you're late, etc. So there's so many different experiences of all different walks of life. And I think that we're all blindsided really to what someone else is feeling until we have a conversation and kind of close our mouths and actually listen to other people. We can really make our kind of expand our minds and to be able to think more diverse around everything that we're trying to do.
Yeah. One thing that I've seen, and I was speaking to a leader yesterday about empathy and how that plays a role. I think with what your experience has been in public health, how do you think about empathy and innovation in this category and how you're actually helping leaders as well become better leaders to help and assist people in their care?
Yeah. Again, going back to, thinking about people's backgrounds. Some people people that are coming into healthcare for the first time, they may have more of an academic background and haven't had their feet on the street. I think it's really important to offer historical lessons to people around different healthcare practices that occurred even hundreds of years ago. My mentor, Glenn Ellis, he is a historian as well as a bioethics professor and expert, and he has instilled in me the history of different communities and things that they've faced. So I think it's really important for, younger leaders to be able to understand the historical trials and tribulations of various communities to be able to expand their thinking and create innovation in healthcare. But empathy is at the forefront of all of it. If you don't feel passion for the community, it's going to show.
With that, what are like some common challenges as well that you think is commonly faced in public health?
Yeah, there's a lot of challenges. I think the distrust of people, again, with authority figures or people whom they may think have a different intelligence level than them, when in fact that's not true. People just have a different focus on in life or in their career and have a little bit more education around things, but doesn't make them any smarter or anything like that. But I think that a lot of challenges really surround the siloing of government agencies. The SNAP office doesn't talk to the WIC office. So how are you supposed to get care from both places? You have to do multiple public benefit applications. And if those agencies would talk together, we would be able to have a more simplified process for people to access benefits, and which would really help a lot of people. Last year was over $70 billion left on the table in public benefits, and which is sad because a lot of people have a lot of incorrect thoughts around public benefits. Maybe a lot of people think, oh, there's someone else who needs it more than me. And that's not true. Everyone is entitled to having a healthy life and being able to actually make it in this world. And that's what these programs are designed to do. And everyone should have equal access.
Absolutely. I think thinking about that kind of brought me to the thought of impact. And so what do you think is something that you've done in public health as an initiative that you think has had a tremendous impact on community and bring about people's lives to achieve more and do more?
Yeah. Well, I hope it made an impact, but I've seen, and I've had some testimonials, but years ago I managed an asthma management program, and the asthma management program went into the community, into the neighborhoods of low-income individuals in the Medicaid communities, and actually brought clinicians and practitioners and educators to them to help them understand their child's asthma, things around environmental triggers or different ways to use their inhalers, etc., and really brought education to them and in a way that they could understand, very culturally appropriate ways to deliver information. I think that I've had parents come up to me and said, thank you so much. I don't get time to talk to my respiratory doctor because the wait is 6 months to get an appointment because of the provider network, et cetera. So I've traveled around the country and really brought this program to many different people and managed it and helped to create different games and programs and just different ways of thinking for people to help them manage asthma and make sure that they understand that it's not something that should inhibit their lives.
With what you're saying there, how do you think leaders can educate themselves and help educate the population as well to bring about the changes they want to see? Because I would think that's a complex process. You're dealing with a lot of people, a lot of individuals, a lot of backgrounds. So what can be done there?
Yeah, I think the most important thing is listening. Stop running around and trying to look for a press, and sit down and talk to a mother. Talk to a child and see what are you facing? How can I help you? How can I bring my resources to you to make your life better? And I think that we're always kind of sitting at the table trying to figure out solutions to things, but we're not bringing the people in that are affected by these problems and these issues. And I think listening is the most important thing that we can do.
Is there certain tools that you think leaders can use? Is it doing research? Is there different thought processes? What would you advise on that side? Let's say if you're an advisor.
Yeah, if I was a leader and, in public health and I was a new leader in public health, I think the first thing that people should do is go out into the community and do a community health program, do a community event, go to the YMCA and do a food grocery pickup. Be there in the streets, be there, talk to a community health worker, see if you could shadow a community health worker, see what the problems really are, and get a real feel for the individuals that you're serving. I think that's the most important thing a leader could do.
Yeah. I know you had talked about blind spots as well. What are some other common blind spots, and why do you think those typically happen in this, public health industry?
Yeah, I think a lot of people, including, this includes myself as well, I think a lot of people just have judgments around different cultures or backgrounds, and we really need to take those biases and look at them objectively and expand our minds and our thinking by talking to people. By maybe if you don't have time to research, just have a conversation with someone, maybe of a different background, or maybe it's a new neighbor or whoever it might be, or you're at a community health program. Sit down and talk to somebody. That, there's a lot of judgments in low-income communities around people on Medicaid. And I think that those biases really need to go away, but we need to educate ourselves. A lot of people think that people on Medicaid don't work, when in fact they do work. And, I think that people are starting to shift in the right direction to be more inclusive of people, but we're not there yet. And it really takes a village, not just one person individually.
Something you mentioned there also brought me to the word accreditation. So how do you think accreditation also plays an impact in public health and making sure that people can actually be skilled or have enough impact to bring about the change they want to see as well?
Mixed feelings with accreditation. I think that when I hear accreditation, I think of bureaucracy, honestly. I think there's a lot of important community-based organizations out there doing great work out there that may not have the funding available. I will say that, they can't afford for accreditation processes through certain things, or maybe there's not an accreditation process for certain initiatives or organizations. One accreditation program, which is the NCQA Health Equity Accreditation, actually has been great for health plans. They're required to capture different information, have different types of innovations and initiatives that are for various backgrounds that do promote health equity. So I really think that the health equity accreditation through NCQA is a great program for health plans. But as far as other accreditations, I don't know if I particularly agree with them, because there's a lot of talent out there, and there's, with maybe some red tape out there for that they have to be accredited. So I think I would really take a look at the accrediting body to see if it's something worthwhile. So I have a little bit of a mixed feelings around that.
Is there any advice that you'd give to people that aren't accredited? Is there things that they can do to, I guess, up-level themselves as well? Because they definitely have passion and care, right? So that's not a barrier, and I think that can make a lot of impact on itself as well.
Yeah, absolutely. I think that keeping on course. Sometimes people get accreditations for things and then they're like, okay, I don't have to do that anymore. Until next year, I have to show the data. So I think it's, taking that momentum and keeping that momentum up throughout the years, or however long, it takes to continue to reapply for accreditations, keeping that momentum, but also taking it as an opportunity to learn, to be able to grow. Because we don't grow through just sitting there. We grow through experiences and bringing different people to the table. So it's really important to keep that momentum going and not just saying, okay, I got accredited and I'm done. Now I'm going to go back to business as usual. So it's really important to continue the fight for innovation.
How does data play an impact in care? And from what you've seen?
There's all kinds of data. There's data from this conversation that we have. I look at data as in just information in general. I think that, there's, like, from my background, like demography and history and all kinds of different health economics data has really pushed us in a direction where we're able to say, you know what, maybe we need to put more focus on the Black community that is being affected by COVID-19, or we need to put more attention into why the Latino community has such great heart disease factors, and as well as the ER visits, etc. I think that data plays a huge role into improving health, and healthcare initiatives have to take a look at those things to be able to create programming and initiatives and various interventions. So it's important that research data is important, but it's also the listening, the data we get from listening our everyday lives, that's also important.
Can you dive deeper into that? Because I think one thing that I was going to say is that, you have data that's important, but how do you not ignore that, what I would call gut knowledge or human touch in the entire process?
Yeah, so being in marketing for a long time, you can make data say whatever you want. It's the question that you're asking and the data that presents itself to answer that question. I could ask, what is the best way to brand my product? Where Chat GPT or somebody else, an expert in the field may say this way. But it's about how you phrase the question and the data that's going to come back. So the data that may come back from that branding would be how other maybe startups or other organizations that have a similar mission may have done their branding campaigns. When in fact, it's how I could ask the question. It says, well, what can I do differently than other organizations? So it's really around the questions that you're asking and how the data can present itself. So, it's not always that, those specific numbers. Sometimes it's qualitative as well. It's not always quantitative data that we need to look at. Looking at people surveys. Surveys are a really important tool because it's the voice of the consumer. It's the voice of the people that are actually answering the questions in their honest ways. So getting more people to do surveys and asking their opinions on things is the right way to do it.
How does data play a role in your day-to-day as well as, head of partnerships?
Absolutely. Data is very important because we're taking a look at different populations of people, whether they're on a Medicare Advantage plan or a Medicaid plan or a D-SNP plan, and taking a look at seeing what's driving these costs. How can we take public benefits and decrease healthcare expenses for the health plans and really improve healthcare access and healthcare outcomes through public benefit programs? So it's taking a look at, how much savings. So someone from SNAP, for example, on a SNAP program would save a health plan $1,400 a year. And that's just an average adult on SNAP. So if I take that dollar amount from that research and data that had presented itself, and I say to a health plan, hey, listen, I can save you a healthcare dollars in the long run through benefit enrollments. That's a really key piece of information that a lot of people don't know. Those who are age 65 and older, $2,360 a year in savings per person. And if we look at other communities, it's even higher, those with hypertension or diabetes or other chronic conditions. We're also decreasing ER visits, taking a look at the data to say, okay, after SNAP enrollment, has ER visits decreased in any way, or hospital admissions, et cetera? Because a lot of people are going to the ER visits because they're not taking care of themselves. They don't have sustenance, or maybe they electricity in their home, or they're not able to have their water on, and they have mold in the home or whatever it is that they have, and they're continuing to go to the hospital to relieve any symptoms they have, maybe from asthma or whatever, or diabetes, whatever it might be, whatever chronic condition they may have. So we're helping to improve their lives. They're looking at that data in order to create programming and initiatives to really enroll in public benefits and the correct programs that actually will help people.
With what you said, how do you balance as well traditional, public health initiatives and what you guys do on that side with, emergent technologies and methodologies?
That's a great question. I think that, taking a look at the system is really important. Where are the barriers? For public benefits access is really tough because there's a lot of factors that go in there. We take a look at time. How long does it take to complete an application? For example, the average SNAP application is 16 pages. How long does that take to go through? Asking a lot of repetitive questions over and over again. We're looking at these old processes and saying, how can we improve them? How can we knock down those barriers to ensure that people have access? So we took a look at time. We took a look at, getting access to a fax machine. We have at Advocatia, we have a self-service platform that allows you to upload documents right from your telephone. And you could do it at 3:00 in the morning when you get home from your long shift after you've made your dinner, took your shower, and getting ready for bed. You could do it then. You could do it in the morning. And if you need to talk to somebody, we have access to, live people on the phone. So it's taking a look at those historical things. And yes, primarily things have been done over the phone for a long time, but we need to get more into the digital age as well for those individuals, the younger individuals, the more tech savvy individuals that want to be able to get right in there, do it from their phone. They don't want to talk to anybody on the phone. They want to just do it themselves, be personally responsible for those things, and really make a difference in their own lives. So it's really taking a look at that historical data data again, of how things used to work and taking that information and making things change through technology.
With that, how do you think leaders or people building solutions can think about the difference in population for age difference, right? Different backgrounds as well. How can they really build that in and think about what they're building in their solution using all those variables?
Again, another great question. I think it's really important, and this may be a little bit of a bigger thing, but really important to make sure that there's people of different backgrounds, a diverse workforce in technology that's able to, have a voice, be able to think things differently, divergent thinkers, all kinds of different individuals with different skill levels at the table and different backgrounds. Technology has been a primarily male-oriented sector. It's great to see more women coming in there and more people of color coming into technology, because as we're developing more programs like ChatGPT, OpenAI, things like that, everybody's background, importance, the way that they think, the way that they speak, the way that they respond is going to be coming out of these AI chatbots and things like that. So we need to make sure that there's diversification in the workforce in technology.
With what you said there as well, how do you think about the intersection of technology and human-centered design and building solutions?
Again, I think it's about the diversity in the workforce and thinking, okay, well, how is it going to affect someone individually? What types of people are we looking to serve through this technology? And what are their barriers? Ensuring that things are intuitive. Are we looking at literacy levels? Are we looking at things like, are you using a mobile phone or are you using an old mobile phone? Sometimes with our programs such as like Lifeline and other things that have free phones for people, they're not always the most easy phones to use because they're not, everyone's used to an iPhone or, a Samsung Galaxy, whatever it is. And maybe they get more of a lower end phone. So we have to think about those experiences in a mobile way and also understand that technology isn't always the answer to everything. A lot of the older generations, not everyone, but there's a great population of people who don't have access to the internet at home. In our rural areas or those who are low incomes, a lot of seniors don't have access. And there are programs out there, and a lot of people may disagree with me, but I think that in the rural areas, and especially those who are very impoverished, the internet is not the priority. The priority is getting food on the table. So how do we get those people to connect to technology? It might be through over the phone. So for example, at Advocatia, we understand that there's people of all walks, individuals on managed long-term services and support. They need someone to interact with over the phone. Not always, but a lot of the time they do because they have different, maybe a disability or, maybe a way that they cannot communicate directly, or they have someone that's there to help them, like a caseworker or whoever it might be. They need that live one-on-one support over the phone. So technology doesn't work in every situation, but it is something that we do need to develop with a diversity in mind.
With that, I think something that maybe you'd give advice to your, fellow colleagues in public health, what would that be really to help foster innovation, really create an environment where, people can really be thinking about forward-thinking processes, being divergent as well in their thinking to really provide those solutions? What would you do to really create that environment or suggest to them to create that environment?
Have people from all different backgrounds. I'm really big on public and private collaboration. Everyone kind of thinks, okay, we're just going to get ideas from the department. Invite somebody from a different department. Invite somebody from accounting. Some of the best advice I've ever gotten were from CFOs of how to present a project or how to present a problem, because we could think of all of the greatest innovations and interventions for people. But if there's not a reason in our that's going to pass the desk of a CFO, it's not going to happen. Invite those people to the table. Let's think about costs. Let's think about the effects from the community on, what they may be going through. Maybe there's a distrust. How do we get through the distrust in the community? Bring people from the community into the picture. Just all different backgrounds. Invite Comcast to the table. Invite a sponsor to the table. Whoever might be, a community-based organization, a community health worker. Bring everybody to the table with different thoughts. Sometimes the greatest and most important thoughts are from those who are very quiet in the room too. So trying to think of a way to promote conversation around those quiet individuals, maybe those neurodivergent thinkers, or those who are maybe just quiet individuals that don't like the attention. try to figure out ways to have them speak in an environment that's comfortable for them as well. Maybe it's through writing an anonymous survey, whatever it might be, but really diversifying the initiatives and the thoughts processes that go in around public health innovation programs.
I know early in the conversation we had mentioned about health equity. What are your thoughts about health equity and, the challenges and everything around that?
Health equity is something that we all strive for, and I hope in my lifetime I'm able to see great changes that are being made. I think that there's so much that has to go into health equity. And it's not just the healthcare space that needs to address it. It's the banking systems, the financial institutions, it's the government agencies, it's, the consumer retail, everything plays a part in that. And if we're really going to make change, we need to talk about politics. We need to talk about profitability. We need to talk about, private versus public. We need to think about how the economy affects individuals. If right now with inflation, it's really tough on everybody right now. And who's responsible for the inflation? People have different opinions about that, but let's put them all on the table for that. And I think that we need to address the way that the world works and the democracy, for example. A lot of people believe that democracy is being taken away. And I think that the people need to step up and they need to have their voices heard as well. So more advocates around is important, but also we need to address I hate to use the word patriarchy, but there is a patriarchy, there, and we need to break down barriers, and we need to diversify the people in charge, and we need to diversify the leadership from all backgrounds. We need to give individuals a chance. We need to make sure that individuals have access to education, so that they're able to become leaders one day. So there's education, income, government agencies, profitability, public versus private. I think that in politics, there's a lot of P words in there. So I think that it's a very challenging situation we're in to make change, but we need to steadfast and keep the course that we can actually change things.
Okay. Some interesting thoughts there. With that, what do you think is things that are maybe commonly misunderstood about health equity and the way that people go about tackling it?
I think that people are very focused on race and culture when people need to think about other backgrounds. I think that health equity is so many different things. Health equity, it affects language, race, so many different factors. And I think that we often have judgments on people that maybe speak a different language or are on Medicaid or, a different situation than yourself, essentially. And I think we have a lot of judgments on people. And again, listening to people to expand our mind and our thought process and not being closed-minded, have an open mind around things. I think that's really important for us to continue to move forward.
Perfect. How do you think about human geography and actually providing solutions in public health?
My love of geography. So it was funny because when I actually started my education, a lot of people were like, how does geography and healthcare even come together? And human geography is really important because we studied demography, we studied migration trends, we studied culture. Pretty much geography is anything in relation to space. Migration patterns again. There's taking a look at fertility patterns, for example. America isn't having as many children as we used to have. There's the potential for us to be in a similar situation as Japan. How can we bring in more diverse families? Latino communities from other countries tend to have more a higher fertility rate. Let's bring them in. Let's talk about immigration and bringing in new people from different backgrounds to ensure that we're continuing to evolve as a country and in keeping our workforce there to be able to support individuals as they age. I think that taking a look at culture is really important. How we develop our programs. What languages are we speaking? What are the literacy levels of things? What problems exist in the culture? Is there a way for us to to bridge our American values for those who are coming in from a different country or a different background. How can we shape healthcare to make it work for them is really important. And taking a look at those factors in consideration when we're developing programming is really important. For example, in a lot of Asian cultures, for example, the male figure, the head of the family, is there during doctor's appointments, where, a lot of other individuals are there for themselves. They don't have that oversight in their family, but that's just the way that their family structures. So it's taking a lot of look at culture to ensure that we're creating programming and healthcare access for those who are coming in from all different ways, because America is a blend of many different cultures and many different backgrounds, and we need to ensure that we're all American and we all deserve equal access to healthcare and a great life.
Very profound words. Can you share an example from your experience where you've actually used applied cultural geography to really provide the right type of benefits in public health?
So I had done various assignments throughout my education. I was an adult learner, so I was in college in my late 20s and early 30s, studying first person to go to college in my family. Very proud of that, even though it was a little late in life. But I did a lot of projects around mapping different communities. So I did some things around North Philadelphia, which is a prominently Latino organization. Where are their providers? Let's map their providers and let's map where people are. Let's see, okay, do they have access to transportation? Is this a lower income neighborhood, et cetera? Like, let's take a look at these factors. Let's look at provider access. Let's look at transportation access. How can they get to the doctor's office? How can they get to the grocery store to prevent food insecurity? Let's look at a bunch of different factors and put them on a map and take a look at them to say this is how we can appropriately create an intervention that will positively impact a community and in particular areas.
How do you think about transportation geography in, potential healthcare disparities as well?
I'm very passionate about this, and I wish I actually had some more free time in my life to focus on that. But there's a lot of issues, especially in rural areas, for people to access a doctor's office or a specialist, particularly because a lot of specialists maybe are in a small business area or a location that is inaccessible to public transportation. So when we're thinking about developing public transportation routes, it's important to ensure that they are going past provider offices, healthcare systems, et cetera, so people can access care. For example, in South Jersey, there is a large migrant farm worker population, and a lot of them don't have access to public transportation because it's so far away from where they live. And they have to walk or ride a bicycle to even get to the bus, to be able to take them 35 minutes to go essentially 5 miles down the street. So it's really important for those who are in transportation to think about and get those different diverse leaders at the table to think about how they can impact different communities and different walks of life to be able to have access to healthcare.
I bet you probably have some thoughts to some solutions, but anything that you can provide, maybe that some leaders can actually work upon.
Partnering with academic institutions who actually have healthcare systems, I think is important. For example, my alma mater, Rowan University, own FQHCs, which is a fairly qualified health center, which is it's just a great type of health system or healthcare doctors that have specialists. They have primary care physicians. Sometimes they even have dentists all in one facility. Mental health, a specialist may come in once a month for asthma, respiratory care, or whatever it might be. But ensuring that those people are at the table who are taking care. So not just the people in transportation, but bring in the healthcare people, to the table to say, hey, listen, these are our patients. And these are the people who need to access that. Let's take a look at our patient profiles. Where are they coming from? And how can we help to develop routing for those individuals? New Jersey Transit for those individuals. Let's create a simpler way for them to access care.
In general, how do you think that leaders can maybe apply that you're thinking towards partnerships with, the public health and other sectors to actually really benefit the community?
I guess the theme in today's conversation is diversity. and bringing community-based organizations and bringing the transportation people together, bringing the providers, bringing the community health workers to the table and saying, these are the issues that we're facing in healthcare. How can we provide better service? Service can be from many different places of business. So we take a look at internet, for example. Let's bring Comcast to the table. Let's Lifeline, one of the mobile companies, at the table. Let's bring maybe a local bank to the table to talk about loans and things like small business loans, things like that could really help people. Let's take a look and bring diverse organizations to the table, because they may have had thoughts, and those workers have come from a diverse background too. Maybe not all of them have worked in banking. Maybe they have worked in healthcare finance at some point in their career, and maybe they remember a program that worked. So I think it's really diversifying those at the table. Public-private partnerships are really important.
I know before we go into the lightning round, I know we had spoke about, innovation previously, but how do you think about public health innovation, especially after everything that happened with COVID-19 pandemic, and really bringing about solutions?
That's a great question, and I don't know if I have the answer for that. But I think that we need to take a look at what went wrong and how we can be prepared. And, technology isn't always going to prepare us, but technology can collect data. And we can collect data around immunizations. We can collect data around those different communities who received vaccinations, et cetera. And we could take a look at that data and really help us to inform of how we could do things better. And in preparedness as well, taking a look at, well, this is what happened before. How can we make sure people have access to the grocery store in a more, easy way? Maybe we go ahead and we activate Instacart, for example, and make that free for Medicaid members to be able to have groceries delivered to their homes. Doubling the pay of those workers that are in the forefront of a pandemic. I think that technology is important because, again, it allows us to see potential future situations and kind of expect things to happen. That way we can address them before they actually do happen. So technology is really important, but data is really important. So this is a really great opportunity right now for us to take a look at how COVID impacted our society and in our just healthcare in general. We know that a lot of people died during COVID-19 and a lot of people's hearts broke during that. We needed to look at that factor too, and that doesn't always come up in data. But, talking to people, what could have worked better? And then being able to implore those types of solutions into technology or planning, emergency planning, I think is important for us to be able to, there will be another pandemic at some way, whether it's 20 years from now or 100 years from now. And I think that if we can establish a historical lessons learned, that will be able to prepare us for the future.
Okay. Now on to the lightning round. So my first question for you is, what do you think is the most underrated factor in healthcare access?
Listening to the voice of the community, not just going to the table and thinking of solutions, because you need to hear from those who you're impacting. I know that I did some work when I was at a managed care organization, bringing in the managed long-term supports and services business into the managed care organization. And there were so many different advocacy organizations at the table. Advocacy organizations are really important to be able to bring perspective from those communities who they represent. And not being the one to talk, being the one to listen. Really, really, really listen. Close your mouth, listen, and then ask questions. And don't be afraid to ask questions, because we're all here to learn from each other. And that's the only way we're able to create change.
What do you think is the biggest challenge facing public health innovation today?
The siloing of government agencies and the bureaucracy around that. I mentioned earlier, not a lot of the time your Medicaid agency doesn't talk to the USDA, they don't talk to the WIC agency, they don't share data due to privacy concerns, etc. And I think that when we're siloing things that should be part of public health, part of public benefits programs, let's make this simplistic for people to apply for public benefit programs. without all of the red tape. Let's give SNAP data to health plans. That way that they can say, okay, these members are not on SNAP. Let's get them enrolled into SNAP. It's a win-win for everybody. But I think really that siloing of government is really hurting us in the long run.
My last question for you is, what is the last public health innovation or initiative that you saw that made you think this will change everything?
Definitely preventative medication for HIV. HIV has devastated our world for 3 decades at least. No, I'm getting old here, maybe a lot longer than that. But I think that, people have been focused on eliminating HIV and AIDS for a very long time. And this type of innovation in the community is so amazing. And it makes me have hope that we're even closer to a vaccination to really cure HIV and have it as a thing of the past. I'm looking forward to that day. But these HIV prevention medications are just amazing because we're really decreasing that population of people who are infected with the disease and bringing more life to those people. There's so many more treatments now that are available, and I think that it's a devastating illness that people have to suffer through, and all around the world, not just in specific communities, but all around the world. It affects everybody. And I think that these type of programs that, allow people to do research and, development in vaccines is really important because we want to have a healthy America. We all want to see our kids grow up one day, and we want to see them be healthy. We want to see our parents age with grace. We want to see ourselves in a comfortable situation and healthy. That way we can live the longest lives possible. So I'm very excited that there are HIV prevention medications out there to help us to eradicate that, because I think that's one of the biggest public health epidemics in the entire world.
Well, Autumn, thank you for sharing your thoughts on public health and for everything that you shared. Based on our conversation today, what are some of your final thoughts?
Some of my final thoughts, I think, are listening. It's really important to listen to those who you're trying to serve and those who you're trying to create interventions for. It's really important to think about ROI as you're developing public health interventions and programming, as well as what the future is going to look like. Taking a look at historical events that may have happened and how that they actually addressed, and how we can take lessons learned from things to create innovation and bring our technology at the forefront to be able to solve problems is really important. But just really taking a look at the historical trends and trying to make things better is the most important thing. And we do that through diversity. We do that through listening. We do that through just pausing for a moment and really saying, how can we make this better? And, how can we make everybody healthy? So I'm excited in this journey, and I hope I continue for the rest of my life in public health. And I encourage all of those from all different backgrounds to understand and know that they are a part of public health and that they do have great ideas, and hopefully can inspire those who are in education fields, getting their college degrees and things like that your expertise and your background is important to those leaders in public health.
Well, thank you again for your time on the K in Clarity podcast. Where can people connect with you if they choose to do so?
Love LinkedIn. LinkedIn is a great forum for conversations and for connections. So you can find me on LinkedIn, linkedin.com/in/Autumn Baidouri. Feel free to contact me there.
Perfect. Well, Autumn, thank you for your time again.
Thank you so much. I appreciate you.